Hello, everyone. Thank you for joining another edition of um, a webinar by United Spinal Association. My name is Jose Hernandez. I'm the president of United Spinal Association, and now I am the new community organizer for the Consumer Directed Personal Assistance Association of New York State, also known as CDPANIs. Today, we're talking about this very important topic called fair pay for home care, which would increase, or which will, I'm gonna put it out there. I'm gonna say will increase the minimum wage of home care workers to 150% of the minimum wage. Today in New York State and across the country, we are in the worst home care workforce shortage that we have ever have had. Um, Many individuals with disabilities are suffering in silence, and we'll go into more of the details of that later on. Today we are in webinar mode, so you can see us and we can't see you. If you want to ask a question, you can do so by using the Q&A section, or just to keep it casual, you can also chat and put it into the chat, and I'll be monitoring that as well. For those of you who need subtitles or live transcription, you can either click on the closed captioning button on the bottom of the screen or click more and select the show subtitles or transcription. So with that said, I would like to introduce Brian O'Malley, uh, the director of CD Panties, to tell us more about the policy side of fair pay for home care.
Hi all, and I, as Zachary said, I'm looking through the list of names here, and it's great to see so many voices that or so many names I recognize and have been right here fighting with us in the trenches over the past year and a half or more. Before I go into the full policy of fair pay, I want to take a moment and frame it. And I didn't clear this with Jose first, so probably throwing this whole event off. But um, you know, coming into fair pay, we at CD Panties and others, like we have to remember where we were 2 years ago, right? Like it was 2 years ago where former Governor Cuomo, and after the news of yesterday, let's keep it that way, um, did cut Medicaid, cut eligibility for long-term care, going into a days after a global pandemic was declared. A global pandemic we're still dealing with. And it's not that that was the first action, right? This was a sustained effort over 3 years. We were finalizing in the last year of a Save CDPA campaign over that period of time, where literally the future of the program was in question. We came before that, there wasn't active harm being done, but there was passive harm. It was a decade's worth of neglect. The reimbursement rates were frozen, costs were going up, wages were going up. There was no enforcement of managed care, so they were just slashing and burning reimbursements to providers with a wink and a nod from the executive, all in the name of cutting costs. Because we know when it comes to Medicaid, if you want to cut costs, you go at it through long term care. That is why the global cap was so harmful, remains harmful to this day. And that's the position we were in a little more than basically 2 years ago as we were coming out of the budget. And we sat there and said, you know what? What else can they do to us? Apart from fully repealing the program, what else can they do to us? It's time for all of us to go on offense. And so that's what we did. That's when we got together. The caring majority came together, CD Payne's hand in hand, Jay Fredge, and all of our partners came together and came up with the notion of fair pay for home care. And fair pay really is, Zach, I'll say you are the caring majority member. Um, and and the all of us came through and said, enough's enough. We need an investment in home care. And as we move through, we came up with this policy that is an investment in the number one area that has suffered as a result of this decade's worth of neglect, the 3 to 4 years of active harm that were taking place. And that is ability to recruit and retain a workforce. And that's whether we're in CDPA or in the traditional side. And we looked at that. And so what has that been? This has been a CDP's position for about a decade. And we wanted to get back to a position where we were in about 2006, when the wage for workers in New York City and in and around the New York City area was $10. The minimum wage was $6.25. Now, we're not saying we wanted to go back to an era where the minimum wage was $6.25. We wanted to go back to an era where home care workers weren't valued at minimum wage jobs. And so that's where this notion of 150% of the minimum wage that fair pay dictates comes from. It's home care, this notion of the minimum wage at $15. Like, we could always get behind that. Like, every worker deserves the right to a wage that they can live on. Work 40 hours, live on the wage. We can argue whether or not someone can actually live on 15, but that's neither here nor there. We could, at the same time, we were supportive of home care workers' wages going up from 10 to 15. That was great. It was when you pulled the two pieces together, and all of a sudden it's like, wait, home care workers are making minimum wage? Like, that wasn't okay. And that's the fundamental issue that fair pay was looking to address. Because as CDP's, as we looked at this, right, Kendra was actually instrumental in developing the survey that we had done over a period of time and over a period of years. And as we had done this survey that we put in a report, the high cost of low wages, we've seen the numbers flip flop to where in 2016, the first time we ran this survey, 60% of consumers said they never were looking for a new PA. It just wasn't something they had done over the course of the past year. In 2021, that number was just over 20%. Meanwhile, the number of times that a consumer was looking over 10 times a year or constantly, in 2016, that was about 5%. In 2021, that number was at the same level as those consumers who never were looking. There, a full 22, 23% of consumers were always looking for new workers. 10% of consumers were looking for a new worker for over a year. That's unacceptable. 10% doesn't sound large, but there's 150,000 people using consumer directed. That's 15,000 people who took more than a year to find a worker. That's unacceptable in a state that prides itself for being an icon of how government should work. And so, what we looked at with fair pay was not just wages. It was an overall investment in home and community-based services. It is the definition of New York saying, New York State values an individual's right to live at home. Part of that is paying workers the wages they need to provide the services in the home, and so that consumers, so that agencies can recruit new individuals, so that we can keep the individuals we have. The other part of that is making sure that the money is in the system so those wages can be paid, so that agencies aren't trying to constantly, do what poor folks all over the country do of figure out, do I pay the phone bill or the electricity? What's more important this week? So that people aren't taking out lines of credit to meet their payroll costs. And that is where we are today. And so realistically, this is the investment that we need to make this system function the way it needs to make New York the beacon of how home care should and can look when we actually value the people who are in it, when we value the workers, when we value the disabled and older folks who are using the services, and when we value the agencies that are out there doing the work to make sure that all of that comes together in one system. And if we do that, this is a once in a generation opportunity, realistically. I mean, we are talking about putting $5 billion of new money into a system. And it is legitimately on the table. And we have a chance. And all we have to do is fight like hell for the next 2.5 weeks. And we can make this happen. As Jose said, it will happen if we all do everything we can for the next 2 weeks. And I'm excited. I hope everyone here is excited, but yeah, Jose, I'll stop talking now because
Oh, thank you, for that background. This is a problem that's been coming for a very long time, and it's something that it's facing we're facing across the country. I've actually never seen anything like this. Uh, I work with individuals who require multiple agencies to get the care that they need, and there's no overlap. You one agency comes in Monday, Wednesday, and Friday. The other agencies take Tuesday, Thursday, and the weekends. So when one person doesn't show up for a shift, then the other agency is no longer required to provide care, but they don't have the workers to send to you. So that's why you need multiple agencies. And individuals with disabilities are left without care. Um, I've had one individual personally tell me that in the last year, he has had to sleep on one side of his body for over 12 hours until the relief shift came in the morning. This person now has a stage 3 pressure sore on his back. And people are suffering in silence. You know, I'm grateful for everyone that's here. And I wish there were a lot more of you, but the ones that are here, we need your voice. We need you to really help push this over the finish line. Um, I've had one individual, and I mentor this guy, and he tells me the agency said they don't have anyone to come in until the morning or the evening. So I'm gonna go stay in the hospital because I don't want to go into a nursing home. But if I go into the hospital using a stretcher, they're just gonna leave me there. Can you get me an Uber from my house to the hospital so I can at least take my power chair? These are the situations individuals with disabilities are facing day in and day out. And not only us, but also our friends in the senior community. They are being left without care. If you can't get up and cook your own meals, shower yourself, um, or do any of that for yourself, then you need home care. And if there isn't enough home care workers because they're being paid so little, then there's definitely a problem. In my own case, over the holidays, one of my home care workers came down with COVID, and I almost ended up homeless, well, semi-homeless. So I had no care during the day. So during the day, I went over to a friend's house so we can share services, and at night I came home because my home care worker was still at home. So I did that for 3 weeks. If I didn't have that option, I most likely would have had to go to a nursing home facility for 3 weeks until my PA would have recovered from COVID-19. So that was me sharing. Kendra, would you like to share a little bit about your experiences and experiences of people who um, you've worked with?
Yeah, hi everyone. Thank you for joining us. My name is Kendras Story. I am a disabled woman. I've been using home care services for more than 24 years. I'm a healthcare policy analyst, so I'm involved in this from a personal side as well as a professional intellectual side. Um, I myself have been struggling with home care services for a number of years. You know, as Brian mentioned, it's pre-pandemic. There were always a shift open in my case. I was always recruiting for someone to fill that last shift for me. And at that time, it was kind of manageable. I missed, a 6 to 8 hour shift and I could handle it. Now, from the pandemic and the extremely low wages, I simply can't find anybody to work for me. I have one worker, that's my brother. He's been working for me 7 days a week by himself for more than a year and a half. He ended up having to get a second job. So now he has a full-time job during the day, and I essentially have 4 hours of care each night, and that's it. So I sleep in my wheelchair almost every single night. It's going on 2 weeks since I've been in bed. It's exhausting, it's painful. I'm unable to reposition myself very well in my wheelchair, so I'm also experiencing those skin breakdowns and beginnings of pressure sores. I'm unable to get nutritious food on my own because I just can't do the cooking by myself, and I can do very limited feeding. So I've actually developed a couple additional medical conditions because of that. So now I'm on additional medications and I have to see via telehealth because I have no way to get to a doctor, see my doctor more regularly. Actually, I'm supposed to be getting in for some blood work before they'll give me my next round of medication. And it's proving to be extremely challenging to find a lab that's open on weekends during a time slot where my brother's available to drive me down there. So, this has been impacting me personally for a long time. And, when I kind of came to the realization that we all need to get together and fight for fair pay, I had been on the board with CD Panies for a couple of years and got introduced to some folks at the Caring Majority here in the Hudson Valley in New York. And we just talked about what were the issues. We went through all different pieces of it, and we all together, people with disabilities, seniors, home care workers, decided that the low wages is what would impact our situation the most. If we could raise that wage to a level where we could recruit quality folks and retain them, we'd be able to benefit from that in such a significant manner. And then we can look at tackling the other pieces of home care that need to be addressed down the road. So I've just been so proud and happy to be working with the Caring Majority and working on fair pay for home care. It's one of the first times I've experienced in my life where employers and employer consumers and workers and provider agencies all come together on the same ground, and we're fighting together, we're pushing together, we're moving in the same direction. And it still is very much led by people with disabilities and the home care workers, the people most impacted. And that's really important to me, that that's the way that the campaign is driven. And that's exactly my experience of working with the Caring Majority. So if those are important values to you, as well as ensuring that you have quality home care workers, please get involved and work with us. We need more voices. We want to hear from you. We want to hear your ideas. And If you only have a couple minutes a day, that's all right as well. If you only have a couple minutes a week, that's also all right. Anything that you can offer is really terrific. So I've also been working with some clients who have been experiencing some difficulties through the home care process. One of the individuals that I've been working with was without a home care provider for a number of months and was struggling to get through, and unfortunately ended up hospitalized and was hospitalized for quite some time. And now his condition, although he's back home, he's still struggling to find care. His condition is such that the deterioration that he's experienced from being in the hospital and experiencing this medical emergency is permanent. And now he requires significantly more home care services and other medical attention. And so it's really, really alarming when you hear these stories that we've allowed it to get to this situation, that our state has allowed it to get to this situation, because certainly it wasn't us, right? It's not the people who were impacted. We've been out on the ground, as Brian said, for quite some time. We were pushing for Save CDPA, and we've been shouting as loudly as we can that we need to focus on home care and long-term care issues in New York State and nationally. But now we're finally at the point where we have such a great organizing team, and we have gathered so many folks together who are sharing their stories about how they're impacted. And that really is powerful, and it really does push things forward for us. We've been able to get great momentum in the state legislature to be behind us and to be behind fair pay for home care. And now we really need to get Governor Hochul on our side. And your personal stories and your participation with this campaign is what's going to help.
Thank you, Kendra. It goes even beyond that. Like at the beginning of the pandemic, for those who know me, know that I have had a home care worker for 11 or 12 years. He was closer to me than my actual father was. My mother had passed away a long time ago. So he was there for the most crucial moments in my life. You know, when I got my first job, when I got my license, and basically living life. This fair pay for home care would be an investment in the home care workers, but in turn, it would be an investment in us. We won't have to worry about. I'm sorry. It's whenever I speak about this, I get emotional because it's a scary thought that when you come to think about it, that when because of our disabilities, we are at risk by no fault of our own of going into a nursing facility and losing everything that we have accomplished. My home care worker died making minimum wage to a state that didn't care about him. And every day is a scary thought for us as individuals with disabilities to think that our home care workers could say, you know, something, I'm moving on and going to work for Amazon for $21 an hour. And as a result of that, I could end up in a nursing home. I could lose everything that I have accomplished, everything, and go into a nursing facility and possibly die because of the neglect. You know, how many of our brothers and sisters realistically lost their lives across the country in nursing homes due to the lack of care? Not because of the actual care in the nursing home, but the lack of having qualified or home care in their homes. Someone that's hired by agency. Everyone has left the industry and they don't want to come back. So fair pay is going to be the only way that we can honestly value the people who come into our homes.
Yeah, and
I'm sorry
Jose,
about
if
that.
I could, no, thank you so much. It is a really emotional topic because it touches us so intimately and impacts our health and our mental health and our daily lives. I just wanted to address, Lois had a question. We are working with unions in the state. So SEIU 1199 is part of the fight for fair pay for home care. And there's also a group of home care unionized agencies down in New York City that have now joined on. So it's really exciting to see, because they do bring a lot of power to this campaign. But to kind of bounce off what Jose just talked about, here in the Hudson Valley where I live, the minimum wage is still $13.20 an hour. And that's where most of the fiscal intermediaries start their wages, because those reimbursement rates are just not high enough for them to offer anything higher than that. And so what Fair Pay for Home Care does is really ensure that those reimbursement rates are passed through the managed long-term care plans to the fiscal intermediaries directly, so that, and the other agency providers, so that they can actually offer a higher wage to their workers and our workers. So it's $13.20 here in the Hudson Valley. Fast food is at $15 an hour. Amazon and Gap factories, which are just 10 and 20 minutes from my house, are offering $17 and $18 an hour. And Target is starting over $20 an hour right now. I can't compete with that. How do you ask someone to perform such intensive labor for you? They're lifting your body, they're moving you, they're responsible for, respiratory care, wound care, medications, assisting you in the bath, toileting, dressing, grooming. And then on top of that, all of our IADLs that are so crucial to living, like cooking and cleaning and laundry and the errands that need to get done. It's exhausting work. I had a worker for me. She was amazing. She was with me for 3 years. It was her first job. So I got her when she was just out of high school. She was 18, and we had a really great relationship. It was more than just my employee. She felt like a little sister to me. And we did a lot of social events together. And one day she came to me and just said, I can't keep working for you. I can't live on this wage. She had her own place. She had a daughter of her own, and she was trying to make it. And so she left for the Gap factory because they were offering at that time, almost $4 an hour more than I was able to offer her. And it was just really sad, to not just to lose that relationship, but to lose it when neither of us wanted to. And we kept in contact for quite some time thereafter. And she would tell me stories about how much she hated the work and that she wanted to be in home care, but she just couldn't make that decision for herself and her child because it wasn't a responsible one fiscally. And I hear this often, that my workers are forced to make a decision to leave a career that they love, that they enjoy, to leave clients that they love working with, that they've created these family bonds with, because the wage isn't enough. So if we valued these workers and provided a dignified wage to them, they would be leaving this industry at a significantly lower rate than they are now, significantly. And especially if we can get fair pay for home care and the full fair pay for home care at 150% of the minimum wage, because then we'll be able to compete. I'd be able to offer a wage higher than retail, higher than fast food, higher than these factories that are recruiting folks and just taking advantage of them. And I think that we need to recognize that this is labor-intensive work. This is real work. It's not the same as companionship, and that's kind of the narrative that we need to be using when we talk about what is home care and everything that it entails.
And I wanted Brian to come in and talk about the governor's proposal to provide bonuses over wages, and in my personal opinion, that's not enough. It's definitely not going to recruit anyone. And you can go through the particulars on the rate structure and how many hours a person has to work. Most people won't qualify for it, but yeah, Brian.
So, thanks, Jose. And I will do that 1 second. I wanted to get just piggyback off Kendra's final point.
breaking up a little bit, Brian.
Difficult work. It is it is work people generally love. I apologize. My internet, I'm at home working from home, and my kids are both home, so I apologize. They are sucking up all of my bandwidth. The reality is, if this work were performed by people who look like me, we wouldn't have this conversation. This is work that is primarily performed by women and women of color, immigrants. And that it is the continued devaluation of that work, combined with the devaluation of the disabled community and our elders. And we can talk a great game, but in the end, it is that is driving us to the situation we find ourselves in. And the governor, as Jose said, the governor did put forward bonuses. But to her credit, and I will give her some credit, she wanted to do something and looked at bonuses, saying, okay, we have this federal money, and we have federal COVID money. We have a lot of federal COVID money, 1.1 billion to be specific. And she wanted to do something with that to provide assistance. And since it is one-time funding, she wanted to put it into bonuses. The problem is, you have to work at least 20 hours a week in order to get the bonuses. What we know is 1 out of 3 PAs won't get a bonus. Upstate, above Westchester, that number is 50%. 1 out of 2 won't get a bonus. Less than a third will actually see. For some of you who have heard this, you'll have heard the governor say repeatedly, $3,000 bonus. Less than 1 in 3 will actually see that 3,000 number. And even for those who do, all it takes is the consumer going to the hospital, and boom, you get potentially no bonus for no reason other than you. What if the PA gets COVID and they wind up in the hospital? Now, not only have you been in the hospital and had COVID, you don't get a bonus. Like, there are so many factors that can influence this. And at the end of the day, as Jose said, we're not going to be able to recruit folks on the premise of possibly getting a bonus 6 months from now. Because faced with $13.20 or $15 and a potential bonus 6 months from now, or a constant wage of $17, $18, $19, people are going to take the consistent wage every time. In Albany, I look across the river, and it's not a Gap warehouse, it's an Amazon warehouse. They're starting at $17.50 with a $3,000 bonus. Okay, so both are offering a $3,000 bonus. This one pays $4 more. That's a no-brainer. People want to do the work. Amazon warehouse, I think, is generally regarded as a terrible job in every facet of the word, but it's $4 more. That's real money over the course of a year. And people want to do the work. As Kendra said, people are forced to leave. But as Jose said, once they're gone, they're not coming back. We can't get these folks back. And so we need this proposal. And we're at a spot where, yes, this is one-time money. The federal money is one-time money, but we know that we have the dollars. It's always The former governor was very fond of talking about his economic development dollars. He was very fond of, he gave $750 million to Elon Musk to build a gigafactory out in Western New York. He wanted to give a couple billion to Amazon to build a headquarters in the city. He loved throwing economic development dollars around to really rich people. Well, we know this is economic development. And it's economic development that comes from giving money to low-income workers who, unlike Elon Musk, unlike Jeff Bezos, are not going to invest in the stock market. They're going to go to the store and buy diapers. They're going to go to the store and buy food. They're going to pay their rent. They're going to pay their utilities. Hey, maybe they'll go see a movie because now they have a little bit of discretionary income. And that money is going to come back out in the community. So, folks, first off, won't be on public assistance. Right now, over half, 57% of home care workers and PAs are on some form of public assistance. That will stop. Likewise, folks will go from getting the earned income tax credit to paying taxes. That's new revenue from the state, for the state. This makes the state money. And all of these stores where folks are spending their money will pay higher taxes off the revenue they're earning. So this makes the state money. And we know that this is going to pay for itself in the out years. And we can't live in a society where we say, oh, when we give Jeff Bezos money, it's going to come back 12 times over. And, with the state, through all of the jobs he creates, this will pay for itself. But when we give low income folks money, oh, well, this is just a drain on society. This is just, handing out money and it will never pay for itself. Like, it either pays for itself or it doesn't. You can't have it both ways. And so, we are in this spot where we know, and we are pushing out these numbers, and we'll put it in the chat in a minute. We have the numbers. One-time investment. We can either flush it down the toilet with bonuses, or we could invest it. And we invest it by paying home care workers and knowing that that's going to create 80,000 jobs over the next 8 years, 10,000 jobs a year for the next 8 years. That's going to result in people investing in low-income communities and building those communities from the inside. We're not going to replace people. We're going to build communities from the inside. This is a win for New York. It's a win for the disabled folks and older folks who need services and can't get them today. It's a win for the home care workers, and it's a win for communities across the state because it is a $5 billion investment into these communities through these higher wages, through these higher pay. And so, we need this, and over the next few weeks, we have a really ambitious schedule to make sure we get it. Tomorrow at the governor's offices on 3rd Avenue, we're going to have an event, Providers for Fair Pay, showing that broad provider support for higher wages for home care workers. We are hoping providers, consumers, workers all come to 3rd Avenue, 611, if I'm remembering correctly, 3rd Avenue, and at noon, and show their support. If you're in the city, come on by. I'll be there. Jose will be there. Laura will be there. We'll all have fun together, and we will look to move forward. Next Tuesday in Albany, we're getting everyone together. We're going to meet with, we're going to have some legislators, and we are going to do a press conference and rally right in the Capitol. Make sure they see us. They make sure they can't avoid us and hear us and know that we are pushing for fair pay right in the Capitol. That's going to be across the state. If you sign up in the registration, I think we'll put the registration in the chat. Lunch, we'll have lunch for you, and we are going to make them know we're there. Next Friday, Jose is working with Congressman Torres, who is going to echo our sentiment that bonuses aren't enough. They're a waste of the money that the feds gave. He's going to sit there and at his district office in the Bronx, let Governor Hochul know, don't waste this money we gave you. As a member of Congress, we got you this money. Don't waste it on bonuses. Invest it in the future of our state. That's next Friday on the 25th. We are constantly moving forward. We're constantly doing actions because that's what it's going to take. Because frankly, while we have right on our side, we've all been doing this long enough to know. And if you're on this call, you've been involved in policy. You've probably been involved in the fight for fair pay. Right is great, but it doesn't win the argument. And as Kendra said, as Jose said, there's been a lot of organizing so far. We have come a long way, but there are, the voices against this are getting louder now that we're closer to winning. And we have to get louder. We have to match this. We have to battle DOB and battle DOH and get our message out there that guess what? The governor, you need to do this. You need to join the legislature and you need to make sure that we are matching wages to a level that will actually let people recruit, will actually let people keep their workers, will actually deliver the home care services people need to stay out of a nursing home. Because I think there was new news yesterday that the nursing home count, even the updated nursing home count, was lowballed. We know, and it didn't take a rocket scientist. No one needed, none of us, I won't say no one, none of us needed COVID to tell us that nursing homes were not good places. Society did, apparently, but we all knew. We need to make sure that we don't lose this moment, that we get the investment we need so that 20 years from now, people are asking the question, you're going to a nursing home? Why? Right? Like it can't be the norm. We need to make home care the norm. We need to create that system that the expectation is care at home, and fair pay is the start to doing that.
Right now, we have the support of the Assembly and the Senate. They have included fair pay for home care in their one house budgets. And now begins the negotiation process because the governor chose not to put it into her budget at the beginning of the year. And we have so much support. This is like never before. We have home care workers, we have the disabled community, we have seniors, we have allies. Everyone is speaking about this. And, right now we need all the support we can. And you can contact Governor Hochul. Yeah. Just like Brian said, Governor Hochul is the person that we need to contact and let them know how this is affecting us, affecting our families, affecting our friends, and affecting the home care workers. Laura from CD Panties, she put up a link that has all of the events that's going on. If you can participate in one of them or all of them, please, sign up. And um, this a small sacrifice now means a generation of individuals with disabilities won't suffer the same fate that we've been doing for the last 10.
And Jose, if I could just piggyback on what Brian was talking about with the bonuses, just even further how it's going to impact consumers and home care workers. I had a home care worker a couple of years ago, and because those wages are low, our home care workers, as you heard from Brian, most of them are on Medicaid, SNAP, or housing assistance for themselves. And this worker in particular, she really needed to keep her Medicaid and SNAP eligibility because she was a single mom. She had a very young toddler at home who required vaccinations consistently, as young children do. And on the third week of every month, she had multiple jobs. She would bring all her pay stubs to me, and we would sit down and go over what her income for the month was. And we would use her job with me as a way to ensure that she had not too much income so that she could continue her SNAP and Medicaid eligibility. And I would do that by scheduling her the last week of the month to not have as many hours as I would typically like to have had her work for me. I still keep in touch with her still to this day, even though it's been a couple of years that we haven't worked together. Because once again, we all really become so close and intimate. And she's one of my good friends. And she works outside of home care now and would never come back unless the wage increased. And she told me that if she were still working for me and she received this bonus, that she would quit before she got the bonus because it would knock her off of her Medicaid and her SNAP. And so sometimes in some situations, these bonuses for those that are receiving a partial or a full bonus is actually going to be detrimental for them overall. If they do receive the full bonus, what is that going to pay? What is that going to do for them? It'll get them maybe 1 month's worth of rent paid. Maybe it'll get them a month of a couple bills paid. But in the end, they've lost eligibility for the month that they've received it and now the month after, so that they can once again lower their income and qualify for the program. So it's actually providing a little bit of money, but overall, it's a net loss for their budgeting. And so we really need to be aware of that too. There is this benefits cliff. And I just want to echo what Brian and Jose have been saying about the actions that are coming up tomorrow and all next week. Please get out there. If you can't get out there, talk to your friends, talk to your family, talk to your colleagues, ask anybody to show up in your place. It's really important that we have people out there in numbers to demonstrate that this is a loud group, this is a proud group, and we are going to continue to push for fair pay for home care until we win. Another thing that you can do if you really can't get out there, but you want to do something, sign up with the Caring Majority. They have an action a day for 5 minutes. And honestly, it doesn't take 5 minutes. Sometimes it's 30 seconds. And each morning you'll get an email and you click on the link and you send out a tweet. You share something on Facebook. You send an email off to Governor Hochul, or you follow the instructions and you can give Governor Hochul's office a call. It's so simple, it's really easy. And so I do recommend that if you are someone who is absolutely unable to leave your home for any reason, to please participate in that way as well.
And I wanted to add one thing now. If you're in the New York City area or in New York in general, please sign up for email alerts and become a member of CD Pennies, become a member of United Spinal. We put out this information from time to time, and it's critical that you stay informed, stay connected, so that we all of our voices are heard. Are there any questions?
I'm happy to hear Robert in the chat saying it really is that easy, because it is. So please connect in some way. And something else that I've heard from a client of mine in the past was that they never reached out before. They didn't reach out any sooner because they thought that they were the only one and that it was somehow their fault that they were experiencing this, that they couldn't find home care workers, that there was something they were doing to make their home an unwelcoming place. And I just want to urge all of you that if you ever have thoughts that you're doing something wrong because you can't recruit and maintain a workforce of home care workers and personal assistants, that there are thousands of us out here who are experiencing the same thing. And that says it is not your fault. It is not my fault. It is not our workers' faults. It is the fault of the state from devaluing these jobs and neglecting home care for over a decade. And please empower yourself and reach out, connect, and be a part of this movement.
I'm going to go even further. If you're connected to any, support groups or any meetings where there's other individuals with disabilities, that might benefit from this, please share the information. It's very important. This video is going to be on the NYC Spinal website. We're going to send it to everyone that was registered. CD Panties is going to share it. Please, let's get this going and let's get fair pay for home care passed. Closing remarks?
I will say for years, we resigned ourselves to, we can't ask for this, it's too much. We can't do this, it's too much. We're on the verge of $5 billion in funds. And, I wish it hadn't gotten to a point where it was going to cost $5 billion, right? Like, ideally, this program kept up all along, and for a couple million every year, a couple $100 million each year, we're actually maintaining instead of getting to a crisis place. But thanks to the work of so many people, thanks to the work, everyone, because what this really was all along was, it was no one person, it was no one organization. This was, oh, I know this person over here with the NAACP, so let's get Hazel Dukes and the NAACP to endorse this. Oh, I know these folks at AARP. Oh, I know the union. We'll get the union to endorse it. Oh, I know these folks over here. We'll get them. And it was a collective effort building this campaign. It was a collective effort writing this legislation. It was a collective effort putting this organizing out there. So many different people, and we're on the verge of something historic. Like this is massive. I actually wrote this out last night, and I just kind of had to laugh. Like, oh my God, like $5 billion. Like, we have the guts to actually ask for this. Like, and not only that, we might get it. We can't stop. This isn't going to happen again. Like, we have to win this. We have to win this because we can't waste this opportunity. And we have to win this because people, I don't want to get more phone calls I can't answer of how I can't find workers. What do I do? I'm tired of that phone call. I'm sick and tired of it. And even more, my guess is all y'all who can't find workers are sick and tired of being in that spot. I just have to listen to phone calls, and it's terrible. Like, I get probably 10 to 15 of them a week, and it's horrible, but I'm not living that. And I recognize that. We have to win. Let's not get this close and fall up short at the, I'll keep the cliches coming. Let's not get this close and fall up short at the 1 yard line, right? Like, we have to win. There's no other option. And I'm in it. Like, I always say I can hang by my toes if you tell me there's an end date. April 1st is the end date. Everything we can until then. Let's go.
That's it. Yeah. And with that, I want to thank everyone for joining. I want to thank Brian. I want to thank Kendra and Fair Pay for Home Care.
Thank you so much for having us, and let's get this passed this year. We can do it, and you can be a part of it.
Thanks, Jose. Thank you, everyone, for being with us.